Next important nerve, radial nerve, the thickest nerve of the brachial plexus. Yes, radial nerve is formed by the C5, C6, C7, C8, T1. All the roots are
Recording in
there.
progress.
Now, this nerve is running through the our spaces of the arm. Getting the point? Yes, sir. It will pass through the spaces of the arm and then immediately it is passing to the posterior side. Remember, the radial nerve is the nerve of the posterior compartment of the arm. It is running through our radial groove and then again it is coming to the front side by piercing the lateral intermuscular septa at the level of the coracobrachialis insertion. Okay, so remember the ulnar nerve, it was going from entry compartment to the posterior compartment. At which level? Sir, coracobrachialis insertion, CBI, coracobrachialis insertion. And radial nerve is crossing from entry compartment to the posterior compartment by piercing the lateral intermuscular septa. At which level? Sir, CBI, coracobrachialis insertion. And remember, the median nerve is crossing the brachial artery from lateral to medial side. At which level? Sir, at the level of CBI, coracobrachialis insertion. I told you the three important viva questions for the first MBBS student. Okay, sir. So radial nerve is coming here. We all know there is our median nerve, brachial artery, biceps tendon, and radial nerve. So this is the same our M, B, B, R relation. Now this radial nerve is coming and it is dividing into the superficial division and the deep division. Remember, the deep division will pierce the supinator muscle. Yes, sir. Supinator is pierced by the deep branch of the radial nerve and it will run at the back side. Yes, posterior compartment of the forearm. So this is nothing, sir. This is the posteriorly running nerve behind the interosseous membrane. So it is the posterior interosseous nerve and this nerve is running towards our, yes, anatomical snub box. We are putting the drug abusing substance here and then rubbing here and then in this way. So remember, this is our anatomical snub box. It is very important for the short note for the first MBBS students and it is very, very important for the NEET PG and the FMGE students because 5 clinical points are related with this anatomical snub box. We will discuss in any another session. Now try to catch at this point. Sir, this radial nerve is coming and it will give the sensory nerve supply to the dorsum part at the base of the thumb on the palmar side and on the dorsum 1, 2.5. Few textbook will say the lateral 3.5. And muscles, no sir, on the dorsal side no muscle is there. So all the muscles of the posterior compartment of the arm, one thing, and all the muscles of the posterior compartment of the forearm, these are supplied by the radial nerve. Better to say all the posterior compartment muscle of the forearm, they are supplied by the pin. Now gold medal question, except what? So your answer is mnemonic ABE, Abe, Abbe Saleh. Do you remember that famous actor Moin Akhtar Sahab? Yes, Abbe. So you have to remember that Abbe. A for, yes sir, anaconius. It is not supplied by the pin, but it is the muscle of the posterior compartment of the forearm. B for brachioradialis and E for extensor carpi radialis longus. This is very important question asked in your NEET PG exam also. So remember, these are not supplied by the pin, but these are directly supplied by the radial nerve. Getting the point? Okay. So one time again revision. First you have to describe the formation, then course in the axilla, then in the arm, then course in the forearm, then you have to describe its course in the hand. Okay, so look at this part. Sir, radial nerve is coming from the brachial plexus. First point. Sir, it is the branch of the posterior cord. Second point. It is formed by the all the roots. So you can see here C5, C6, C7, C8, T1. All roots are contributing in the formation of the radial nerve. Okay, sir. Now, in the arm, yes, sir, it is running in our radial groove. So just try to understand, sir, this is our humerus. Correct, sir? Here is the shaft. This is the medial epicondyle and this is the lateral epicondyle, capitulum, and this is the trochlea. So radial nerve is coming and then it is running in the posterior compartment. Getting the point? So what is happening? Sir, it is running within the radial groove and then it is coming on the front side. Okay. So this is just a simple diagrammatic presentation of the radial groove. Okay. So radial groove is giving the branches. Yes. Above the radial groove, in the radial groove and below the radial groove. So this diagram is important for the first MBBS students. Above the radial groove, yes. How you can remember? You can remember with the mnemonic Yes, LMP, last menstrual period, is your mnemonic. What is this L? Remember, it is giving the branch to the long head of the triceps. M for it is giving the branch to the medial head of the triceps. And P for, you can remember, the posterior cutaneous nerve of arm. It is supplying the skin of the posterior side of the arm. LMP is your mnemonic. It is very important. The course of the radial nerve in the arm. Now, in our radial groove, remember your mnemonic is MLA, and MLA is playing the polo. So your mnemonic is MLA, polo. M for, yes, it is giving the branch to the again medial head of the triceps two times, because medial head is most bulky. Then A for, yes, L for, remember this is our lateral head. There was the long head, here is the lateral head. And A for, very very important, anconius is given the branch in the radial groove, NEET PG question. And P for posterior cutaneous nerve of the forearm, and L for, sir, lower lateral cutaneous of the forearm. So these are the points which you will, lower lateral cutaneous of the arm. Okay, you can forget this cutaneous branches, but that branches are important. Now remember the branches given by the radial nerve below the radial groove. So you can remember with this mnemonic, yes, baby. You know, below the radial groove, sir, it is giving the branches baby. Yes, sir. B E B B E E B E B E. Just like the beb, hi beb, bebe. Okay, bebe ko bhais pasand hai, something like that. Salmon voice song, you know. B for, sir, brachioradialis is given below the radial groove. Yes. E for, you can remember the extensor carpi radialis longus is the muscle of the posterior compartment of the forearm, but it is given below the radial groove. And B for, you can remember our, yes, Mr. Brachialis muscle. And E for elbow joint. Yes, brachialis is the hybrid muscle. It is supplied by the musculocutaneous as well as radial nerve. That's why we are saying the Mr. Brachialis. So here one branch from the our radial nerve. So these are the points how you can remember the different branches. Your mnemonic is LMP, MLA polo, and here is the bebe. Okay, so the same thing you can observe here. It is giving the branches. Sir, it is giving the branch to the long head of the triceps, medial head of the triceps, and posterior cutaneous of the arm. So L, M, P. These are the branches above the radial groove. Now you will see it is giving the branches to the our, yes, anconius. It is giving the branch again to the medial head of the triceps. It gives two times branches. Okay, sir. And here it is giving the lateral head. So you can see the M, L, A. It is giving the posterior cutaneous nerve of the forearm. So po is here and low is here, lower lateral cutaneous of the arm. So that diagram which I form for all of you, that is easier. Now see, it is giving below the radial groove the brachialis, brachioradialis, elbow joint, and extensor carpi radialis longus. You can remember this is the NEET PG question. Your mnemonic is bebe. Okay, now come to the our forearm part. Sir, it is giving the superficial branch, and this superficial branch is giving to the our digits. Yes, skin of the lateral 3.5 of the dorsum part, it is supplied by our radial nerve, but you can see it is piercing, it is giving the deep branch which is piercing which our, yes, our supinator muscle. Okay, Ayan Devarma, roll number 67. So the students who are giving their roll number, you will get extra mark. Okay, Ayan, so very good better, and inform to all the students. I know this code word. Okay, this code word only the RIMS students can understand. Okay, Ayan, very good better. So now see here, this is our what, sir, posterior introsseous nerve which is giving the branch to the supinator muscle. Now it is supplying all the muscles of the posterior compartment of the forearm. Yes, sir, it is giving the branch to the extensor carpi radialis brevis, extensor digitorum, extensor digitum minimi, extensor carpi ulnaris, abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus, and extensor indicis. How to remember this name of the muscles? We will do different session. लेकिन बेटा कम से कम अभी ये याद रखो, all the muscles of the posterior compartment of the forearm, they are supplied by the pin except Abbe Sale. A B E. A for anconius, B for brachioradialis, and E for ECRL. So remember the Moin Akhtar Saab, the great actor. Okay. So now we are looking, this nerve is ending here at the wrist. Sometimes there is the abnormality at this part, and you will see there is the formation of the ganglion, ganglionic cyst. तो कोई भी बेटा आपके घर में, आपके फैमिली में किसी भी केस में आप देखते हो यहाँ पर डॉर्सम पार्ट में एक एलिवेशन हो गया है, तो वो कुछ नहीं है, इसी रेडियल नर्व में एबनॉर्मलिटी, एंडिंग वाले पार्ट में एबनॉर्मलिटी कारण होता है, दैट इज आवर गैंग्लियन डिसीज. ओके, नाउ try to observe radial nerve compression at the axilla. Sir, radial nerve compression at the axilla, it will result in the many symptom. Yes, जो लोग बैसाखी की मदद से चलते हैं तो उनमें आप देखोगे कि ये रेडियल नर्व का कंप्रेशन बैसाखी के कारण हो जाता है, एंड ऑल द स्ट्रक्चर्स, ऑल द ब्रांचेस ऑफ द रेडियल नर्व, दे आर गेटिंग डैमेज. सो दिस इज नोन एज, yes, crutch palsy. Now look here, this is the very famous Saturday night palsy. Yes, Saturday की नाइट को पार्टी सेलिब्रेट किए, ड्रिंक किए और चेयर में सो गए. So there is a compression of the radial nerve along the edge of our chair. So this is our Saturday night palsy, radial nerve clinical point we are looking, and this is the very famous. And I want to tell you, today there was the FMGE 2023 जुलाई सेशन. अभी बेटा कुछ 3-4 घंटे पहले खत्म हुआ है. ये रिसेंट क्वेश्चन आपका आया हुआ है. Whenever there is a radial nerve injury, extensor muscle has been gone, so patient cannot extend the wrist, so there is the wrist drop. Getting the point? And now look here, this is another situation, sir. It is our finger drop, very important. Yes, radial nerve is injured, so you will ask the patient to extend the wrist. He can extend, but he is not able to extend the finger. Finger is getting dropped, so this is our finger drop position. And now see, this is the one new situation, new clinical. This is our honeymoon palsy. So try to understand what is happening at time of honeymoon. Yes, lovers, they are sleeping in such kind of the manner, so there is the radial nerve compression due to the heavy weight. Okay, so this is honeymoon palsy. It is again related with the radial nerve. I am going to tell you the permanent treatment for this honeymoon palsy. Yes, you can cut the hand or you can cut the throat. This is the permanent treatment for the honeymoon palsy radial nerve injury. I am just kidding, don't take seriously. Okay, so these are the different points. Can you tell me this NEET PG 2019 question? There was the image, here was the arrow, nerve supply of the area marked by the arrow in this image. Tell me which nerve is supplying this part of the skin. This is the question. Comment at the comment box. Okay, so these are our different point. One more thing I want to tell you for the orthopedics integration. Try to understand. If radial nerve is injured here, then what will happen? Radial nerve is the nerve of the posterior compartment of the arm. Orthopedics integration. Posterior compartment of the forearm. Yes. So there is the loss of the extension at the our shoulder. No, the extension at the shoulder is done by the climbers muscle, the latissimus dorsi, so it will not be lost. But can you see this elbow extension, this your wrist extension, and the finger extension? So these are the 3 extension, 1 2 3, just like the Michael Jackson. Do this one. This is the Michael Jackson cap. So there is the 1 2 3 4. I told you the 4 movement. Yes, 1 2 3 4, Michael Jackson dancing style. Radial nerve injury, high radial nerve palsy, low radial nerve palsy, I am telling you. So remember, whenever there is a radial nerve injury, high injury, sir, there is a no damage to the our, yes, shoulder extension, because it is done by the latissimus dorsi and the pectoris major. Okay, so the one is normal. But if there is a damage to the radial nerve at the axilla, so LMP gone, MLA gone, polo gone, pin gone, all gone, so patient will not be able to extend the elbow, not able to extend the wrist, not able to extend the finger. So patient will present with the flexion of the elbow, yes, wrist drop and the finger drop complete. But if the patient is having injury at the radial groove, so our lateral head and medial head, they are normal, triceps is normal, so elbow extension will be near about normal. Only the patient will present with the wrist drop and the finger drop. Okay, sir. But if there is a damage of the radial nerve at the cubital fossa, remember, below the, yes, below the radial groove, this is not seen commonly. At the cubital fossa, it is seen commonly. So at this side, so your LMP is normal. Okay, sir. Your MLA is normal, so triceps is normal, so patient can do extension. Okay, sir. And also the brachioradialis and ECRL, they are normal, they are crossing the wrist joint, so patient can do extension at the wrist also. Okay, sir. But patient will not be able to extend the finger, so there is the finger drop. So this is the clinical. Yes, I told you about the radial nerve. One more thing, ulnar claw hand, ulnar paradox. I want to tell you about the ulnar paradox. Try to understand. If there is the ulnar nerve injury at the lower side, remember, whenever nerve injury at the upper side, many symptoms are seen. But if any nerve injury lower side, less symptoms are seen. But ulnar paradox, paradox का मतलब क्या होता है? उल्टा. तो ulnar nerve के केस में उल्टा. If there is a lower injury, more symptoms are seen. If there is the higher injury, less symptom. क्यों? If there is an injury at this our carpal part, so remember, at this time there is the our claw hand. Okay sir, claw hand. But remember the flexor digitorum profundus is given branch above. तो फ्लेक्सर डिस्ट्रम प्रोफंडस जो है वो नॉर्मल है. गेटिंग द पॉइंट. सो इफ देयर इज अ लोअर इंजुरी, flexor digitorum profundus is normal, so it will cause more and more clawing because flexor digitorum profundus is normal. Yes, our third and fourth lumbricals, they are also normal, so more clawing there. Okay, third and fourth and lumbricals paralyzed, so claw hand. But flexor digitorum profundus, the medial half is supplied by the ulnar nerve, so they will cause the flexion, so more clawing you will see when there is a damage at the our carpal part, hand part. But if there is a damage to the ulnar nerve at the upper part, so claw hand will be there. Yes sir, but flexor digitorum profundus is also paralyzed, so the flexion, the clawing will be less because flexor digitorum profundus is paralyzed, so it is not able to flex the finger. So this is the difference. Upper injury, less symptom, okay, but lower injury, more symptom. This is the paradox. Hope you all are getting the point. So this all about our today's class. So at the last, it is not my country's duty to push me ahead, it is my duty to push my country ahead. बेटा याद रखना, हमने देश को क्या दिया है, हमें ये सोचना है, हमको ये नहीं सोचना है कि देश ने हमको क्या दिया है. ओके, स्टेबल बनिए, पढ़ाई लिखाई कीजिए, अच्छे से एग्जाम दीजिए. हमारी पूरी सेरेबेलम टीम आपके साथ है और हम आपके साथ खड़े रहेंगे इस एग्जाम को अच्छे से क्रैक करने के लिए, हमेशा हमेशा के लिए. हमको ये सोचना है कि हमने देश को क्या दिया, ये नहीं सोचना कि देश ने हमको क्या दिया. सो थैंक यू वेरी मच, गॉड ब्लेस यू ऑल. एनी डाउट बेटा, प्लीज आस्क. Actually today there is our FMG session, okay, that's why we have to close this session soon. Any doubt, please ask beta. This is the rapid session for all of you. Hope you all enjoyed and get ready for our upcoming session for the physiology and our biochemistry part. You will enjoy too much. Okay, yes, thank you Shreya, thank you, God bless you. This annotated file will be available in our app, Cerebellum Academy app. Okay, so I want to leave राइट नाउ बेटा, क्योंकि अभी तुरंत हमारा एक अगला सेशन चालू होने वाला है जिसमें आज ही एफएमजी का एग्जाम हुआ है. तो उसमें सारे जितने भी क्वेश्चंस थे वो किस तरीके से हमारे पढ़ाए हुए टॉपिक्स से आए हैं, उनका एक एनालिसिस पूरे 19 सब्जेक्ट के महारथी करने वाले हैं. तो बिल्कुल भूलिए नहीं, 8:30 को हम लाइव हो रहे हैं, सारे के सारे 19 सब्जेक्ट टीचर. तो अभी मुझको इजाजत दीजिए. फिर से जाते जाते सिर्फ हंगामा खड़ा करना, सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं. कोशिश है कि सूरत बदलनी चाहिए, हमारे सीने में नहीं तो तुम्हारे सीने में ही सही. कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए. जुड़िए हमारे फर्स्ट प्रॉफ सेशन के साथ. हम अभी खूब इंजॉय करने वाले हैं और एग्जाम को हम बहुत अच्छे तरीके से क्रैक करेंगे और साथ में गोल्ड मेडल भी लाएंगे. Thank you very much. God bless you all. All the best.